background which you have put.
Thank you very much. Uh, uh, Dr. Chirag, can you give me the option for share?
Yeah, yes, sir. It is already available.
It's already there, yes. Okay. So, uh, yeah, I hope everybody can see my screen now.
Visible, visible.
Yes. So now moving on towards the session, it was a very wonderful presentations from my previous speakers regarding all the cardiac rehabilitation and tele-rehab. Yes, the topic for me is virtual rehab and is particularly into intensive care units. So what we are going to discuss is that how can we create a virtual environment into the ICUs. And yes, so it is ICUs are considered as a critical care unit, so intensive care units where the patients are into a critical care and they are into supervised medical care. So they are much more sensitive compared to the rehabilitation wards or probably OPDs. So how can we incorporate those virtual rehab? Yes. So virtual rehab is like today what we are doing. So before COVID era, nobody had thought about webinars or nobody had thought about conferences onto the virtual platform. Yes, but nowadays what we are doing is everybody is coming up with all this virtual rehab. And as Dr. Chirag said, I do have my virtual background with me, so I've incorporated that virtual background in my presentation also. So how can we create a virtual environment into the ICUs, and is it safe enough, and is it competitive enough? So this is what we are going to discuss. The presentation flow will be like this. We will be just discussing about the definitions, what are its uses is in the medicine and rehabilitation purposes, especially into the ICUs. What are the pros and cons, and certain we would see about a bit evidence-based and conclusion. So yesterday I was just came to know that there were certain internet issues also, so we had shifted the platform also. So this is all a technology competent. Yes, so how can you incorporate that technology? So before demonetization, nobody had thought enough of digital currency which would be accepted in the country so wide. So as it has now been accepted, it has becomes easier in COVID era for all the purposes also. So this is what we need to think about now. Before moving on towards the presentation, yes, I would request everybody to maximize your volume, and look into the screen. I would like to have a virtual tour. I would like all of you to be into a virtual tour of our presentation. Yes, so please maximize your screen, get into full mode, and make your volume as loud as you can. Maximize your volume, and just concentrate on what is going on to the screen. Okay, so here we go with our presentation. Two, one. So we are on a virtual ride, world tour. Yes, this webinar helps you out in world tour also. So we are somewhere around London currently.
Sir, we from the first International Web Physio Summit, we yesterday I got a message that the whole world is in my room. You created that stage. Thank you so much. And today you have showed this that you can go through London city streets as well to the Malaysia or Singapore or these countries like that.
Yes. Dr. Chirag, soon we are entering into my room.
Okay,
We'll be
that's so.
entering into my kitchen also.
Oh, that's so good. Hats off to you, sir. You have
So you
showed
can
us.
have apples and oranges.
Okay,
No issues.
are they properly sanitized?
Yes, definitely. So a dip into my swimming pool, and where you can find turtles and fish swimming around. We'll be seeing mountains, an aerial view of nature. So if you can see me, please clap the hands also together while watching this and enjoy the virtual environment. We'll be entering into Dubai. Yes. So this is what the virtual environment can do. So I hope everybody liked this and they had a wonderful tour for this virtual world. Yes. So basically, what is virtual environment? So what I had created currently was I created a technologically friendly environment where you can feel that you are into that environment. Okay. So here, what we are doing it, we are attending every workshops or every seminars through our room and through our house. Yes. So practically through the virtual media, you are connecting. So that is what we are trying to do in this virtual rehab. So what is virtual rehab? It is nothing but it is creating an artificial environment. Yes. So basically, I would like to highlight this. I have a tendency of using this enroll. Uh, you need to create an environment through the softwares where the user believes that it is a real environment. So as of now, we had just 2D dimensions available with us. So that was the reason we had just used a video interface. But when you are using it for therapeutic purposes, yes, you can see a wonderful lady onto the right corner of your screen. She is wearing a virtual VR headset, and she is just imagining that she is into that environment. So it is basically through two dimensions like sight and sound. So this is what we are trying to incorporate into our rehabilitation purposes. So nowadays the technology has advanced significantly, and we are already using this virtual environment into our musculoskeletal disorders, and even for trajectory purposes, and even for athletes. At a point of time, we are using the athlete, that how the athlete what we say, the muscle is working in which movement, and how the trajectory should be done in a particular sports related issues. So how we are going to incorporate. So this is a decade issue related, what we say, decade science which is going on, and it has currently very good evidence supporting the virtual reality into the uh, ICUs. So, not going into much more, we have high-end devices and low-end devices. Currently, what I had shown you was one of the type of flat screen monitor, which makes you go through that virtual environment. So that is somewhere around a low-end system, but you have high-end systems which are, you have the feedback also. So your heart rate oriented feedbacks, your muscle oriented feedbacks are given to the systems, and then you are given a task to complete that system. So it is similar like how you play PUBGs or probably any other games on your cell phone. So basically, somewhere in 1980s, the first virtual system was sold by BPL Research. Not going into much more details. What are VR types? VR types are, first two types are there basically. They are purpose designed virtual environments and commercial gaming software. So what you are, or probably what majority of us are using, is commercial gaming systems in our phones. And into the rehab sections, when we come into, when we talk about rehabs, it is all about purpose designed virtual environments. So whether you want to improve the circumdactory gait, whether you want to improve the breathing environment, or whether breathing pattern, or whether you want to ask the patient to bicycle so that sarcopenia can be avoided. So all these things are purpose designed virtual environments. So they are specifically task based types of virtual environments. And giving you an examples that in medicine, it is used for teaching purposes and diagnostic purposes and colonoscopies. So this is a brief outline. So that is why I'm just moving on very swiftly through this. We would be discussing how it is used in rehab in much more details uh, into the following slides. So in rehabilitation, so we are using it somewhere around 90s, and we have somewhere around 130 to 140 articles in PubMed recently. So it is very well evidence supported research based modality, or what we say, you can say a treatment approach towards your conservative approach of rehabilitation. And basically, as I said, it works onto the feedback. It works onto the feedback of the patient sense position, and then it gives various parameters. Okay, so we would see one of the units before I shift on to the, yes. So you'll see one of the video. So this is basically a breathing technique virtual reality. Yes, how a breathing control can be achieved through a virtual environment. So that, so you can see a circle in this. Yes. So once you inhale, the circle will come towards you, and once you exhale, the circle will go away from you, and even the surroundings will have an effects. See, you can see once you are inhaling, the lights are illuminating. So lights are illuminating. are getting much more brighter, and once you exhale it out, lights are getting dim. So this is the way you are incorporating breathing techniques or probably relaxation techniques into the patients. So this kinds of virtual environments are used basically in ICU's support. So it can be eitherly used with a VR headset or a flat screen monitors. So here you can see, patient is inhaling and exhaling out, and at the same time the circle is coming towards the patient and circle is going away when he is exhaling out, with the various kinds of feedbacks. So this is the way you need to teach the patient. So it becomes, like in conservative approach of breathing techniques, or probably spirometer. What we do is we give a 3 ball spirometer and we ask the patient to inhale and exhale it out. So we focus on those balls, yes, and we ask the patient. So that ball is nothing but a feedback, but it is a mechanical feedback. Here you are considering a technologically driven feedback. You are giving an various virtual environment. Now the question comes that why do we need a feedback in intensive care units? Yes, we all know that intensive care units, this is what is in your front of the screen, that intensive care units are nothing but they are special wards. They are special wards organized as a system based, yes, and where critically ill patients, like we are currently facing pandemic for COVID-19 issue. So there are various positive patients lying into the ICU units, or probably various critically ill patients lying into the what we say hospital ICU units, and continuously there would be some or other beeping sounds. Doctors will be coming and going, and you may see certain patients dying in front of you. You may see certain emergencies coming in inside the ICUs. So this all creates a negative environment, and the patient, when post discharges, post hospitalization, faces a post traumatic stress disorder, PTSD, and the quality of life of that patient hampers. Yes, and even the relatives are not allowed in intensive care units. So patient feels lonely in this circumstances. So how you can reconnect that patient, and how you can improvise your rehabilitation. You can improvise through this virtual environments. And even the previous session was talking about tele rehab. So you can incorporate your tele rehab component into these ICUs. So this is way, because of this all this ICU concerns, you have inactivity, you have respiratory issues, cardiac issues, and post, after coming out of ICUs, you have musculoskeletals and balance issues coming into the picture. So this is what happens. Yes, so this what happens is that there is a delirium. Yes, delirium means a depression kind of feeling, and that is basically through sensory deprivations, visual, auditory, and tactile stimuli. So there is pain, depression, nociceptive pain stimulus is also working out. There are unpleasant sounds, lights coming throughout the day. So just imagine a patient lying into an ICU for 15 or 20 odd days and then coming out of that. So that has indirectly caused a trauma to the patient, both psychologically and secondary, because of inactivity. There would be certain components which will be damaged or which will be deteriorated, basically, or musculoskeletal issues like balance and proprioceptions, anxiety, discomfort. So to overcome all these things, we need a virtual environment which can be created throughout the ICU units without hampering the uh, treatment. So basically, what I said, post hospitalization, there is a reduced quality of life, and studies have investigated that alternative methods can be used to complement the traditional treatment, and sufficient level of activity can be reversed. So basically, where we can use in rehabilitation purposes, breathing exercises with the video which I had showed you. We can ask the patient to cycle. The next video will show that. You can activate the cardiorespiratory systems. You can activate the cardiac muscle also through various virtual mechanisms. And to also you can there are certain painful procedures like mechanical ventilation, so catheter insertion. So while during those procedures, if you give a virtual environment, a part of patient attention would be away from that procedure, and you can easily get it out through that. So that is why we are using a virtual reality. So basically, virtual reality is in the ICU. They can be used, one, for determining purposes also, that whether the patient is able to do a task oriented approach or not, or for healing purposes also. So that is the reasons we are using nowadays virtual reality into the rehabilitation. So here you can see your note I will be using. Uh, yes, so you can see a flat screen monitor onto the left side, and you can see a healthcare professional, and this is the joystick which the patient is holding. So patient would be given a task oriented. She would be playing the game in the ICU. You can see nasal cannula, you can see urinary catheters, so oxygenations and everything is going on, and patient is playing. So through this you have various outcomes which can be calculated. Yes, so this is from one of the article which is published in 2019, which has been mentioned below this figure. So here, how do we work it out? Yes, so let me explain you in detail about this. So here we have a flat screen monitor which is actually showing you the virtual environment. Then you have your parameters controlling devices, vital signs monitors, and mechanical signatures. And then there is a relay kind of system in this between. So what happens if a task is given to the patient? Yes, so actually the patient is doing a task of in the flat screen or into the virtual environment. So here you can see various motion sensors are there, various tactile sensors are there, thermo sensors are there, vibration sensors are there, etc., etc. So based on the sensory systems, the sensations, and based on the purpose, we use the feedback mechanisms. So the patient is doing that task, and so that is given to that monitor and to the system records. Again, that system goes back, it gives and works onto the relay systems, and it relays in coordination with your basic parameters. So it would see that if your heart rate has suddenly increased, so it would give a lesser task, or whether the SpO2 level has dropped significantly, it would stop up. And there are security, there are mechanisms wherein the healthcare providers can also be called through this virtual environment. So this is where the patients are basically given a treatment or rehabilitation support through virtual environment. Uh, yes, we had seen this. Now we would be seeing another task-oriented video. Okay. So this is the way the heart rate is measured into the. So see, you can see the stress creates heart rate spikes. Yes. So if a stress environment is given, yes, you can see the track also onto the screen. The stress makes the game hard to play. Now on to the right side, you are seeing breathing out and relaxation work. Yes. So as based on the coordination, so based on the coordination with your heart rate and your breathing pattern, the game will change. So this is way uh, we incorporate virtual environment into the rehabilitation systems. So now the question comes, how do we utilize this? So there are simple joysticks. There are simple joysticks which can control this mechanism. Okay, so there is no more hard things or various huge equipments needed for this purpose. So this is where we incorporate. So basically, you would have seen that it is much more impressive. It visualizes and it creates, the user gets engaged into this. Yes. So if a patient is admitted into ICU, the patient will not feel bored or probably will not feel depressive for doing this. So you can always figure it out. The interest oriented games into the rehabilitation purpose. uh, Basically, as I said, has more watching than and enjoyable than reading purposes. It creates an enjoyable experience, and you would do that. So once you had that feedback that you are supposed to inhale for this many seconds, and you are supposed to exhale for this many seconds, or probably you are supposed to cycle in this manner, so that the proper feedback can be given. So this would be incorporated slowly and slowly into your daily routine, and definitely it creates an educational value. So these are basic advantage. And secondary, there are chances that there are language barriers into the patient and to the healthcare providers. So basically, this virtual environment breaks all those barriers and helps you out in this rehabilitation focus. So basically, what is it? It is interesting. You can configure it, individualize. Yeah? You cannot have 3 volt spirometry, you cannot have 5 volt spirometry, but you can have an individualized protocol for a patient compared to a single generalized protocol for every patient, and it has a biofeedback. So you can change that protocols based on that various biofeedback mechanisms. But what is it? At a certain point of time, it lacks flexibility. So what happens that the sensors needs to be utilized in a proper way so that the actual feedback is given. So if they are not in correlation with your relay system, or probably with your monitor, or probably with your software systems, it may give you a wrong reading, or probably the purpose oriented of rehabilitation will not be solved. Again, you don't have a human connection. So a therapist going to ICU and giving a treatment, probably a doctor going to treat ICU and giving the treatment, and then suddenly coming into a virtual environment. So this patient is seeing that artificial environment coming into the picture again and again. So there is an ineffective human connection into this. And sometimes we all are addicted to TikTok, thanks to Sonam Wangchuk, who had recently, somewhere around couple of days back, he had given that we should boycott the Chinese app. So that is the reason the Chinese app TikTok and PUBG and all those will be now gradually will reduce from our cell phones. Else, we had never thought about reducing all these apps in our cell phones. So that is what we get addicted. Again, it is expensive, and there are no laws concerning whether to use the virtual rehab. It all depends upon the healthcare provider, hospital authorities, whether they are allowing or not. So that is what it is. It has disadvantages. So basically, what we had seen, it is a difference between a real world and the virtual world. Lack of human connection is there, addiction is there, and not suited for unconscious patients or very critical ill patients into the ICUs. So, what are our challenges? Uh, Clinically acceptance, we would require much more clinical acceptance into this segment. Interface, uh, all these interface probably will be from a Western country origin interface. So we need to develop our own Atmanirbhar Bharat. Yes, so we need to develop our own interface supporting our own people and our own hospital setups. Yes, so that our own healthcare providers are also custom, and our own patients also feel easier while using virtual reality, virtual reality interface, and the less of the equipment cost should also be less. So this is what Rutgers University in 2002 had said. They have mentioned in this details. So that is what we are looking out. This is evidence-based. Yes. So in 2013, Dr. used VR to reduce ICU delirium. Virtual reality helps intensive care patient recover. Yes, virtual reality dreams leads to rehabilitation of ICU patients and various other evidence for virtual reality. So basically concluding it versus virtual rehab and conventional rehabs, interesting. It is boring, conventional, well-defined software, simple mechanized devices. Virtual environment, there is a human touch. Virtual rehabilitation is a bit expensive compared to your conventional rehabs, and it provides an accurate data and feedback, whereas the conventional rehabs, the data or the feedback differs from healthcare provider to provider. So this is one of the interesting videos which you can see. Yes, the patient is doing bicycling, and she is walking into the what we say forest area into the ICU. You can see in mechanical ventilation also. So at end, I would like to conclude that we cannot just swiftly go to the virtual environment and say that this is the best modality or best alternative to the conventional rehab. It is just a force amplifier. So with the conventional rehab, you need to add on this virtual rehabilitation for which would be helping the patients and the healthcare system, and there would be a wonderful outcomes. So we have discussed about telerehab just before this session. So with this virtual environment, we will have a telerehab concept booming on throughout the what we say rehabilitation nowadays. And these are the references. I'm very much thankful. I hope you all enjoyed this presentation. And if you have any queries, you can please ask me or drop
Thank you
it
so
in
much,
chat
sir,
box.
for your wonderful presentation. As I told that one of the speaker has told me that they have seen their full world in the laptop. So you have also shown virtually the whole world to us. That is our pleasure as well. And as this summit comes to an end as well with the fourth colloquium, that is cardiophysiotherapy colloquium. Firstly, our patron, Dr. Krishna Garg, is watching us. I would like to request ma'am to please say a few words. Let me check where ma'am. Yeah, ma'am is there. I think if she will be able to start her video and unmute her so that we can get blessings from her as well. Ma'am, if you are listening my voice, please unmute your video and unmute your voice and start your video. I think she is not able to do. So as further proceedings, just I would like to request Dr. Abhijit Datta, our organizing chairman, Associate Dean, Faculty of Paramedical Sciences, Assam Downtown University, to thank our speakers.
Yes, Dr. Chira, can you hear me?
Yes, yes, sir. Please keep the mic near